Eosinopenia is the opposite of eosinophilia, that the number of eosinophil count is low. How much low is normal? There's a difference between different laboratories. Some of the labs say that there are no eosinophils in the periphery, in the circulation, and some of the labs say if it is less than 10, it is eosinopenia. Some say it's less than 50, it's eosinopenia, but we take it that if the absolute eosinophil count is less than 30, this is eosinopenia. And whenever you are going for interpretation of your tests, go for the reference of that particular lab. Now, when you've got eosinopenia, look for the presence of endocrine features of Cushing syndrome. It's one reason that the eosinophil count may be low. Similarly, there are drugs which can cause low eosinophil count. On top is the corticosteroids. Then epinephrine can cause it, the eosinophil counts to drop. And then biologics. These biologics are actually used to treat the conditions caused by higher eosinophil counts, that is the allergic disorders. For example, for the treatment of asthma, these biologics may cause depletion of the eosinophils resulting in eosinopenia, like mepolizumab or restuzumab, etc. And then you can have certain drugs which can produce both eosinophilia and eosinopenia. See, penicillin, cephalosporins, allopurinols, antiretroviral therapy. They can cause eosinophilia. They can also, in some patients, cause eosinopenia. Similarly, ACE inhibitors can cause eosinopenia. And beta blockers, they have variable effects. Some of the beta blockers can increase the eosinophil counts, the others can decrease the eosinophil count. And then you got miscellaneous condition. On top is the sepsis. The advanced sepsis can result in eosinopenia. The mechanism is not known. This may possibly a dysregulated immune response. And then in COVID-19, the eosinophil count has been found in many studies to be low. Some of the studies reporting that even 50% of the patients may have low eosinophil count. The pathognomonic role of this eosinopenia is not clear in the COVID, but in some cases we may think of using the eosinopenia as a marker of disease severity. Patients who died because of COVID, few of these patients had persistent neutropenia. So this may be a marker, but this is not as efficient a marker as the other ones which we have been using in patients who got COVID-19. So this may be considered for marking as a marker of disease severity in patients who got COVID. So these are the different reasons the patient can have eosinopenia.